Welcome to our quick takes. We're here today with Dr. Tammy Vo from Look and See Vision Care in Austin, Texas. Dr. Vo started this practice around 2015, and as it grew and grew, she realized she needed some help. So we're going to talk about the decision-making process that goes into bringing an associate on. Welcome, Dr. Vo.
Cool. Thanks for having me.
So what measures were you sort of watching when you decided that you needed to add someone?
It's like when I didn't want to work that hard anymore, I'm just kidding. It's equally hard having an associate, but I think you'll read online that you should probably wait to be booked out a few weeks. I wanted an associate full-time, not part-time. So I didn't want to just do 2 or 3 days a week. I wanted them to be super invested in my practice, treat it like their own practice. So I felt like full-time is the best way. So I really waited until I was really booked out. 3 weeks.
And did that require like reconfiguring the practice? Because how big is your space?
I have about a 2,200 square foot space. I built out 3 exam lanes. With 2 doctors running full time, it would really be nice to have 4 or 5 exam lanes, but we're making it work with 3 because you have to make it work. But ideally, if you want an associate, you should probably build out 4 or 5 exam lanes. FYI.
There you go. Do you have that option in the space where you are?
I'm hoping one day my landlord lets me expand to the other side to increase, but right now, no. So just making it work. We're like floating patients in and out of rooms. It's fine.
Mm-hmm. And finding an associate, I mean, did that require some negotiating? Obviously, did you kind of have the numbers in mind, what you would be able to afford, or were you kind of waiting for somebody to come to you with this is what I want?
Oh, I knew exactly that I wanted to pay my associate production based.
Mm-hmm.
I felt like that really lights a fire in people who are confident in themselves. So although they're not an owner, they get paid based on how well they do. And so it really kind of sorted out applicants, because if they were kind of nervous about doing production based, I was like, okay, maybe this isn't the right place for you. So my associate gets paid production percentage. I really think that's the best way to go, because they have the potential to make a lot of money or not a lot of money, and then you don't pay them as much because they do things like go on vacation and you don't have to pay them because they're not working, and it's great.
With a practice that small physically, you obviously you need to get along. I mean, how important is that meshing?
It's like so important. Your associate, I feel like, is your marriage partner. I actually call my associate my husband, my work husband. I really hope we're together for the next like 40 years. No pressure. When I hired him, I wasn't like, we're going to be together forever. But basically, that's what I was thinking. Can I be with this person for the rest of my life? I think a lot of practice owners might have a personality kind of like mine, which is maybe a little bit type A. You want things done your way, or else why did you start your own practice? So you should really find someone that kind of meshes with that. I mean, it's good to have opinions and things like that, but my associate chills me out. He, I always say that I'm like the brains behind the operation. He's like the heart. He really just like, we complete each other. I mean, hard to say, but that's how I think you can teach anyone to be a good doctor, which is why we go to school, right? To be a doctor. But I don't know how you can teach someone to be a loving, warm person who not only treats patients like they're their best friends, which is how we have such a high return rate, but also treats everyone else with kindness. And that's hard to teach. So that's definitely the number one thing I would say when you're looking for an associate, is finding someone who has that personality to bring patients into the office, but also the personality to match yours. If you're a Gemini like me, highly recommend a Libra. Super chill. They're really great, and they do what you say, which is great because you own the practice, so you want things done your way. But so it's great. It's worked out perfectly.
That's funny. And when I go to the Look and See Vision Care website and your Facebook pages, you all look like you're having a blast.
Yeah, every day should be fun. here, I hope. But when you're having a blast and your patients feel like they're having a blast, so if you read our reviews and everything, everyone's usually like, oh, I can really tell everyone enjoys being at the office. I like being here too. So I think that's super important. So, brings patients in.
So did you know when this associate came in, when you were talking to him, that this was the match?
Yeah, I think it was pretty clear from the start. I interviewed a lot of people, but this was also good because I knew of him already, so we were friendly,
Mhm.
but we weren't best friends, which is also great because I didn't want to hire any best friends of mine that could potentially destroy a relationship forever. So it was a really good mesh of we know each other, I think we like each other, and now, yeah, it just worked out. He was in town, so it was great. We're perfect. Hey, Travis, I love you.
It sounds like the stars aligned just so for you. Yeah.
Yeah, but I think it's
And
all about that personality mesh for sure.
yeah. And in terms of the practice growth, did bringing the second person on give you the boost that you hoped for?
Definitely. Yeah, of course. I hope when you bring on an associate, your practice is ready for that so you can make more money. Um, it took a slow start, so it's really cool. I love spreadsheets. I love tracking things. And you can really see how he has grown to grow his own patient base, and also his capture rate has grown. So even with a slow start, now it's just been about 2.5 years later, and he's crushing it. So yeah, it's been really great. I get to take time off when I want to, and there's still a doctor here. He gets to go on vacation when he wants, and I'm here. He's going on vacation next week, so that's cool. I guess I'll just work by myself, which is great. So it's fine. I'm always sad when he's gone. I have to work a little bit harder. So yeah, having an associate was definitely the best thing that I've done for my practice.
Fabulous. Dr. Vo, thank you so much for your time.
Thanks. Thanks for having me.